flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Sorry for the delay. We're a little late, but we've got all day. Let's see. Find my stuff here. Okay, you had a chance to look over previous meeting minutes. Any changes?
Mr. Chairman, I move we accept the minutes from the previous meeting.
Second.
Aye. Signing of motions.
Yes, we have three motions from the last meeting to sign. The first motion is 20-282, that's consent agenda to be approved. The second motion is 20-283, to approve the publication of the notice of intent to vacate a platted street in Katy addition to the town of Dunkirk, with a public hearing set for August 7th, 2020 at 10 a.m. And the last motion is 20-284, to approve the recognition of the Crawford County Recovery Task Force as a formal advisory group to aid, support, and advise the Crawford County Commission through the pandemic and the CARES Act funding distribution.
Thank you.
Thank you, Donald.
All right. Mr. Ailing?
I just wanted to do a little setup here of information. I had a great work session with the superintendents of schools from across the county, with the health department and our health officers and the county commissioners. Just wanted to recognize publicly the devotion and the concern that all those professionals have in opening schools safely. And so there's a lot of work going into that, and we're trying to keep the communities and families with good information so that they can trust the school system and the health system with regard to the care of their kids. So I'd just like to acknowledge the health officers that we have, Dr. Stebbins and Dr. Bean, for the expertise that they brought to this endeavor, and really feel fortunate as a county that we have those two individuals to lead us in that process. And then we'd be remiss not to mention Rebecca as the health director for the health department. They'll be doing inspections of the schools, the buildings themselves, but then also we'll be developing plans with all the superintendents in schools to make sure that those schools open safely and address the concerns of parents, because it is a little bit of a nerve-wracking moment to entrust your kids to the public places, but want to assure the community that we're doing everything we can to address all those concerns and to do it with common sense. And I think that's one thing that's driven, that I've seen and observed in our two health officers and Rebecca, is a very common sense approach to balance safety and health with opening up. So anyway, so I'd just like to publicly thank those of you who are serving here today. So I guess Dr. Stebbins, if you want to take the lead on the health officer report.
Good morning, Commissioners.
Good morning.
As Mike was saying, we are in the process of quite a few things going on currently. I'll start with the current state of affairs for Crawford County. As of today, right now, we have 328 known cases that we've had since the beginning of the epidemic. Currently, we have 46 cases in isolation. Those are active cases, and 102 in quarantine. Those are contacts not infected. I anticipate that number will go up today. We have maintained our about 5 average per day increase in our cases over the last 10 days, 8 to 10 days. We'll have the new numbers out later this afternoon. We are in the process of discussions with the school superintendents, as we talked about this morning, and that will be ongoing. We are also in discussion with Pitt State University about their reopening plan. They are developing their plan now. They had a meeting actually yesterday, further refining that plan, and we're working with them to ensure a safe return as best we can, with mitigation strategies and testing as needed. Current hospitalizations, we have 5 positives at Via Christi and 7 persons under investigation, and to my knowledge, we have 0 at Girard still, and we're trying to maintain that. Our hospital system, neither our hospital system nor our outlying clinics are overwhelmed currently by the caseload, so I want to reassure on that, and that follows through community health. And so we, despite the number of cases, the significant medical impact, we haven't been overwhelmed. And so I think we're moving forward just fine with that. We will, each Friday now, give you the numbers in isolation and contacts to help you understand where we're at as we're going forward, as well as the case numbers, regardless of which one of us are here. We're pulling that data from KDHE as they're running the report for us on Thursdays. So if there is other information that you would like, we would invite you to ask us. We'll try to work on getting that data to help you make decisions. We think this gives you kind of a trend so that you can track as we're moving week to week. So.
Number 5 and 7, anyone on a ventilator? You've had some.
Yeah, no, none on the vents. In fact, we've had some long-term vents, and we were able to take those off the vent recently, so that's good. And so we're doing, as far as managing the cases in the hospital, we are a part of the state study at Via Christi regarding the study of medicine, remdesivir. We are utilizing that. It seems to be effective. Yeah, no, we're fine on the vents.
Good.
How are we on the testing? What is that?
So testing, we're continuing the process of the processes we have in place. We have 2 main processes going on right now. Community health through Quest Labs, and then Via Christi through RML. Some of the local clinicians use, I think, MagLab. And then we have 1 rapid testing site at Southeast Kansas Urgent Care with the Sophia. We have ordered through Via Christi the Cepheid machine. I think you guys have got yours on order now. The health department and Girard are looking at the Sophia machines, and have you guys ordered that?
Ours is ordered.
Okay. And now Pitt State is actually looking at additionally, potentially a Sophia or Abbott machine. The challenge that we're all having is that it's 8 weeks out, or 12 weeks.
Right.
And so even if we would have ordered it 4 weeks ago, it would have probably been 12 or 16 weeks. I mean, it's just, that's kind of where we're at in the process of building these machines, and even more importantly, getting the testing supplies. So.
I will mention, community health
That's
Be here pretty quick.
better.
Somewhat relatedly, you'd said something in the work session that struck me, and I wondered if maybe you could elaborate on it. You'd said that the kids in the schools were not the ones likely to be transmitting the disease. That struck me as maybe counterintuitive, so could you maybe
Sure.
explain that a little bit?
Each virus has its own virulence, and we are seeing, or the studies are indicating, with children, we all know that they have less of a disease process. They don't get as sick. But what we're also finding, and what they're portraying to us in the data, is that they also don't transmit as well. And viruses are transmitted by a variety of ways. We know about the cough, the droplet spread, and the mucus and viral shedding that's formed with that, and that's how it gets out. If you're less sick, you're going to have less of that. Some of this is my view of why this is, and so I'm trying to. So if you're less sick, you have less of the viral shedding, and so then you spread less easily. And so with kids, unlike some diseases such as influenza and RSV, specifically with the kids, easier spread. They have copious amounts of mucus, they cough a lot. And so it's a lot more virulent in that respect versus COVID-19 in kids where they're just not getting that sick. In fact, probably some of them, we don't even know that they are sick. And so less viral shed, the body takes care of it, they get through it, and they don't spread it as much.
Is there a tipping point in terms of age that
So as you get into the later school ages, certainly into the high school range, I think that begins to get into more of the adult body style and then adult characteristics. But do you agree with that?
Yeah, I think American Academy of Pediatrics typically says elementary age are low risk, and then as you get to middle school and high school,
So
more low at.
yeah, and the middle school range is probably where we start to tip, because that's where the recommended changes for mask wearing are. So high school kids, higher recommendation. Elementary kids, actually not recommended by the American Academy of Pediatrics currently. And I think we would agree with that. And in the data that we've seen for our county, and I don't have the exact numbers, but very few pediatric cases, right? And so, certainly more dangerous in the elderly, and we discussed that. And more transmission in adult age group, much more transmission in adult age group.
Okay.
Yeah, thank you for that explanation, appreciate that.
Hey, Doctor, just for clarification, you said we had 46 in isolation.
Yes, those are 46 active sick patients currently.
And then the 102 quarantine are the ones that may have come in contact.
Those are close contacts as
Okay.
defined by the health department rules
Thank you.
and actually KDHE rules.
Anything else?
As usual, thank you. Thank you.
All right.
Thank you, guys.
Anything else?
All
Okay.
right. Well, have a good weekend.
Will do.
Danny, you have anything to add? Randy? Mike, very good. Okay. Thank you very much. Thank you for your time today.
I can give a quick update.
Okay.
Just on some, we've gotten quite a few applications for nurse practitioner, for the nurse practitioner position. We've also gotten several for the LPN and then several for the RN. So Michael and I are going to get together next week and look at those and set up a time, hopefully, to start doing interviews. And we'll just see how that goes. So that, I was excited to get quite a few applications on that.
Right.
I don't think there's a whole lot else. I am applying for a grant, the ELC grant I've talked to you about before through the state. I don't have it completely done yet, but I will soon. And I'm hoping to get some, they're called community resource managers. So that what they would do is they could work with the schools, and they could work under an epi nurse to work with all of the patients in isolation and quarantine to make sure their needs are getting met. It would be a great help with the schools. So I'm hoping to get 5 of those. But when you apply for the state, these are competitive grants that other counties will be applying for these things as well. So not always 100% chance that we'll get it, but I think it would be nice to have some community coordinators to make sure people's needs are being met. The other thing I did want to mention is there was a study done out of Springfield, Missouri, where there were 2 hairdressers that both worked ill. I don't know, Jeremy, if you've seen this. They worked for actually several days ill, and they did end up having COVID-19. And there was over 130 contacts of people that were their customers. Springfield, Missouri had a mandate for masks. And out of the it was over 130, it was like 139, no one got COVID-19. So it's just important to remember it's a kind of a layered mitigation, not only the 6 feet for 10 minutes, but when you're getting your hair done, you can't be 6 feet apart. Double masking is important. But that was a really good study that I saw. And I know there's a lot of people out in the community that might disagree, but it's important to have evidence-based practices, I think, to have evidence behind practices. And it was just a good article. I'm sure you can just Google the Springfield hairdressers. I mean, it'll probably come up. So it was very interesting. I think that's it. Unless you have questions, concerns? No? Okay.
Thank you.
All right, thank you.
All right. Anything else? Tim, I know you kind of got bumped today, didn't you?
That's all right. Whenever we're done.
Okay. Oh, we're gonna do it after the meeting today? Okay, sweet. Well, that'll work. All right. Anything else related to that? Okay, do new business. Dawn?
Not really, we've been, of course, trying to get as we get applications for advance ballots in, get those turned around and out in the mail. We started mailing those Wednesday, was the first day to mail those, and still getting a pretty good stream of applications coming in and requests for applications, so we're keeping with that, and that's really all I have for new business.
Okay.
Mr. Chair,
Sorry?
I hate to jump around in front of Jim, but I think while Mr. Bodensteiner's still here, I have a question for him.
That's fine.
Yeah. When we were referring to the option 1, option 2, and I'm just trying to wrap my head around this.
Yeah.
Option 2, that's where it stays with the county, and people will actually send the applications to us, I assume.
Well, we're developing an online application, so all the applications would roll through that system and process. And the same way with under option 1 in the cities, they're going to use the same application. The difference is in option 2, the counties are going to cut the check to every business. Option 1, the cities kind of prioritize their total allocation. You send one bigger check to the city, and then they will divvy that up. But they're going to be using the same kind of application. So we're going to see on the back end anything that a city is doing.
Okay.
Not as a gotcha, but to make sure that we're all
Right, on the right
we're
page.
working off the same playbook. Does that help?
Yeah, it does. I'm just.
Those options took me a while to understand, and I've talked to a couple of the task force members at length about help me understand what the intent of this is, especially with respect to small business and not-for-profits, because my question kept getting back to, well, what's really a business? And how do you define that? And how do you define a not-for-profit? I think that based on the regulations and the guidance, I think we're in a good place with that. Now, hospitals, schools, the big ticket items, Pitt State, those would all remain with the county, irregardless of the option.
Okay. And that's my concern is I want to make sure that our schools and our health systems are taken care
Yes.
of first.
Yes.
And then we see where we're at from there.
Yes.
But I don't want to see a big run, you know, on these funds until our schools and our
I'm
healthcare systems.
extremely comfortable with either option you would
Okay.
select. You know, because we did talk about, and you have the pros and the cons.
Right.
And you just try to separate the philosophical piece to that.
Right.
As best you can, because we all have our own opinions. But I am comfortable. In your budget, what's bolded would be county responsibility, including, you know, the businesses and the not-for-profits that are outside cities. Because this, you know, to be honest, there are gonna be some municipalities that just don't have the capacity to do it. So you're
Sure.
gonna end up doing it by de facto. Probably, my guess would be Pittsburgh, Girard, maybe Arma would be the three municipalities that would really want to do this. What's important though is if a community chooses not to do their own and it's the county responsibility, we make sure, and that would be Greenbush and in the communications, that everybody that's eligible knows about it. That's been one of my concerns, is that, using an example, and I'm not picking on any community, but if I'm a hairdresser in rural Brazelton, do I know about this? And that's part of our job, make sure that happens.
Yeah, that is a concern that everyone's aware of. This is
Absolutely.
available. Okay.
All right,
Well, thank you.
you bet.
You want to do the rest of your stuff?
No, that's fine.
We'll jump to Jim real quick. Jim?
On the agenda for appointments. What I handed out is a request for an appointment to the JCAB committee, which is required by statute for juvenile justice. RJ, they have a board that reviews their policies, procedures, how they spend their money, the programs they run, and they had a request to put Sarah Mills on there, so.
Has she been on there before?
I didn't end up with a copy and I couldn't tell, it didn't look like it.
I think she'd be a true asset to him.
Yes.
So if there's no further questions, I move that we grant the request to appoint Sarah Mills to the RJA, authorizing the chair to sign.
Second.
Aye.
How many do you need, Jim?
Two's fine. Send one back to Angie. Then I just wanted to make a comment on the CARES money while Mike's still here. I think it's gonna be easier and easier to get our head wrapped around this, the more reimbursement and request items we get from the different entities. So we've seen what the school board's looking for. I had Don send out an email to all the county departments to make sure we get ours in. So the more of that we actually see, and here's their dollar amount, here's our dollar amount, here's what all the cities are requesting. Here's
So
what
that's
Pitt
been sent out
State-
to the cities as well?
Here's what Pitt State's requesting. Yes. So what we're trying to do is get an idea on that part of it, so we'll know what to do on the back end.
Okay.
And the numbers are fine, but we can manipulate those, the more requests that we get in, and then we'll know what's left to spend in the other categories. So it makes it easier to get your head around, I think, when we're actually seeing dollar amounts that the different entities are asking for. So we're trying to get that done as fast as we can, because we have to get the dollars figured out by August 15th. So we're trying to get that done in a week. Hopefully, we'll know more about what everybody else is asking for, at least on reimbursement.
Okay.
And then then we'll have a better idea of what the other numbers look like. So that's all I wanted to say.
All right, thank you. Tom, do you have anything else?
Under new business, I might ask that we have an executive session under non-elected personnel at the end of the meeting for 15 minutes.
15 minutes, non-elected personnel.
That's all I have, Mr. Chair.
Jeremy?
I did want to bring up, Don, you sent out that email to everyone, right, about the NACO. So they're having their conference online, the business meeting or whatever, where they elect the board members, and they're requesting each county have a designated like voting person. I wanted to bring that up. I'd been interested, but I wanted to bring it to you guys and see if there was any interest elsewhere in
Yeah.
doing it. I'd not looked to see what day that was. I was trying to find
You
it.
want to, I assume you want to be our voting delegate?
I would like to, if that's okay.
Yes. Do we need a motion on that?
Yes.
Mr. Chair, I move we appoint Commissioner Johnson as our voting delegate to NACO.
Second.
Hi. Thank you. That is all I had for new business.
Okay. Couple things. To jump off the health board portion for 5 minutes of the meeting. You know, during our little recess, we had a concerned citizen about roads in here. And we haven't really talked much, but I wanted to put it out there that we still have everybody working. Everyone is doing their job. The regular maintenance, I mean, we're starting asphalt, chip and seal's coming next week, so it's not like we're not doing it, it's just we're not talking about it during the meetings, because if we did talk about everything, we'd probably be here till dark. So just bring that out in the open, that
Yeah,
things are happening,
I
things
believe
are
they were-
progressing, and
Laying asphalt yesterday, weren't they? Patching?
they have it the last couple days, yeah, so. And they should have received letters if it's in their area, so they can watch out for the chip and seal, but just to bring that up. I would like to, same thing, I do need an executive session for 10 minutes. 3 commissioners, council, and Mike Ealing on non-elected personnel, I guess.
Okay.
We can do that at the end unless you have to leave early. Are you staying? You want to do it now?
No.
So in case you have to leave, I don't want to keep you captive here. That's a motion.
I'll second.
Aye.
So that was everything for new business, old business. Dawn?
The only thing I have, we had made some good progress on the first draft of the budget in the last couple of days, but I had been, tied up with some election stuff as well, and I am not complete on that first draft, so we could definitely have it done. I'm getting close this morning. I came in about 6 this morning to try to finish up.
So you're thinking Tuesday?
Yeah.
Okay.
And there's a lot of things going on, so.
Right.
I know we've got plenty of work to do. That's all I have.
That's it? Jim?
Just a couple of items, and I should ask for this earlier, but I would like a 10-minute executive session at the end of the meeting under attorney-client privilege regarding the landfill contract. And then I just wanted to discuss, I was talking to Mike Bodensteiner about a 9 o'clock work session Tuesday. After everybody's had time to kind of look at both options and
9 o'clock?
right, and the binder, so if you'd like to have that at 9.
Do you know, did you talk to Bobby about Mac Young?
No.
He's gonna be here Tuesday as well, which we can probably,
We can probably put
shift
Mac
it. I'm just
back
putting
at
that out there.
that
He was
meeting.
he wanted to have a work session.
Yeah, for budget, or no, I don't know.
Oh, okay, I didn't know
Court
that.
budget, district court budget, she just gave me this.
Okay,
It just happened. So Mike, at 9,
9, yes.
21st.
That's all I
And
have.
you had 10-minute
10-minute,
attorney-client
yes.
landfill contract. Got it. Tom,
No, sir, no old business.
Jeremy?
I do not have any old business.
I'm sure there is, but I can't think of anything. So we'll do, I guess, Tom's first, executive session on non-elected person, now 15 minutes.
3
Three
commissioners and
commissioners and
council.
council.
Second. What?
He doesn't want a work session, he just on the agenda.
Oh, sorry. Thanks for watching. He's just on the agenda, I gotcha.
We can do that.
Simplified.
And you yet today, huh?
Yes, I'm just hanging out. Yeah. It's my fault, I missed the first.
There's some leftover pizza down the bottom of the fridge.
Well, it's Hamburger Friday. I gave that to Dale. we're all in the same green boat.
Okay, we're gonna go 10 minutes? Executive session for 10 minutes, an attorney-client, 3 commissioners, counsel under the landfill contract.
What was that?
All right, that's everything, right? Then we can move on. Okay, so under future business, July 21st will be a work session, 9 a.m. with Mike Bodensteiner, Greenbush, talk about spark funding, spark funds, whatever. July 21st, also Miss Jasmine Kyle, Business and Promotions Manager for SEK Humane Society, presenting an update on the society. Under announcements, the courthouse in Girard is open to the public from 8 a.m. to 4 p.m. starting June 1st, 2020 until further notice. The motor vehicle office at the Judicial Center in Pittsburgh will remain closed, but residents may use the drop box at the security desk at the Judicial Center for the motor vehicle and tax payments to be processed at the courthouse. Any other business?
Yes. Mr. Chairman, after today's meeting, we are going to have a work session.
Thank you.
Tim Lyman for 15, I'll make it short as possible.
Okay.
15 minutes.
You need a break in between? I guess it don't matter, so. All right, so we'll have a work session with Tim Micah after this meeting.
Do we need to go out of this meeting, Jim?
Maybe adjourn the regular meeting, we can have a work session.
You ready? Mr. Chairman, with no further business, I move we adjourn.
Second.
Aye. Here's, Jim, you want these? You want me to leave them here? RJ.
RJ.